What are obsessive-compulsive related disorders? There are several disorders that seem to be related to OCD. They share similar features such as intrusive thoughts and/or repetitive behaviors. Although similar, there are important differences to consider when looking at effective treatments. These issues each seem to occur in about 1 to 4% of the general population, although there is speculation that hoarding may be far more common. Severity ranges, but when they impair a person's functioning or when they cause significant distress, then the treatment may be necessary. Obsessive-compulsive related disorders include body dysmorphic disorder, trichotillomania or hair-pulling disorder, excoriation or skin-picking disorder, hoarding disorder. Let's see what these disorders are. Body dysmorphic disorder or BDD. BDD story of Lita. No matter how much her mother tried to convince her that it was not true, Lita really believed that she was ugly. At first, she thought her skin was flawed, and then that her nose was too large. Later, whenever she looked in the mirror, she was convinced that she was so disturbing for others to look at that she avoided going out in public. Body dysmorphic disorder defines preoccupation with an imagined or slight the flaw in one's appearance. BDD often includes repetitive behaviors that are done in response to appearance concerns. Trichotillomania, also known as hair-pulling disorder. Malia first started pulling her hair in her teens, and over time she noticed that the hair had not grown back. She was very embarrassed by her bald spot and started wearing hats all the time to cover it up. Malia also started avoiding social situations because of her appearance but still could not stop. Trichotillomania or hair-pulling disorder is the compulsive hair pulling to the point of noticeable hair loss. Excoriation or skin-picking disorder, also known as dermatillomania, pathological skin-picking, neurotic or psychogenic excoriation. Ahmed began picking at a spot on his arm where he felt there might be a small bump. Over time he found himself picking at any irregularity or bump on his skin, resulting in scarring and discoloration. This impact on his appearance made it hard for Ahmed to wear short sleeves, or feel comfortable in social settings in warmer weather. Excoriation or skin-picking disorder is the compulsive skin picking that results in noticeable damage to the skin. Body-focused repetitive behaviors or BFRB. Hair-pulling and skin-picking disorders fall under an umbrella of similar behaviors called body-focused repetitive behaviors or BFRBs. Other BFRBs include compulsive nose-picking, cheek-biting, and nail-biting. Body-focused repetitive behaviors or BFRB define repetitive behaviors that cause damage to one's appearance and/or physical injury. Hoarding disorder story of Raul. Raul found it hard to throw things away, especially papers. He worried that he might throw away something that he would need at a later time. He had collected so much paper that there was no room for anyone else in his apartment. He knew that it was a fire hazard and could no longer use his bedroom, but still could not bring himself to throw things away. In brief, hoarding disorder defines persistent difficulty for getting rid of possessions because of a perceived need to save them. Thanks for watching. Please subscribe and comment.